Yeah, I think we're just gonna go ahead without it. Spanish. Spanish. Still.
Trying to give it another minute or so. Yeah. There won't be any audible. Okay. Oh, okay. Good morning to all of our media participants and the public who are joining us today. It's Thursday, March 11th, 2021. My name is Joe Doherty. I'm the spokesman for the Department of Public Safety and our state's COVID-19 response. Today, we will be starting with Lieutenant Governor Deidre Henderson. She'll be followed by Governor Spencer Cox, who will also be then followed by our state epidemiologist, Dr. Angela Dunn. Lieutenant Governor.
Thank you. Good morning, everyone. It's lovely to be here today. I just have some numbers I want to give, a little update on our vaccine distribution roadmap, and then we'll hear from the governor on a few other substantive things. First of all, as far as vaccine numbers goes, we have now administered 936,681 doses of vaccine. That's a prime and boost. So the prime and boost doses. So that's the first and the second dose combined. Our total doses administered this past week was 151,158 doses, which is a significant increase in the number of doses that we've administered on a weekly basis. So we're really excited about that. Yesterday, though, was our very highest number of administered shots so far during this whole time, and that was 34,290 doses that were given in arms yesterday alone. We're really excited about that. Our workers are doing such a good job to get these vaccines administered. So far, also, 79% of our adults that are over 70 and older have gotten vaccinated. 79%, which is really something to be grateful for and proud of. 64% of the people between ages of 65 and 69 have also received at least one dose. And so far, 29% of our 50 to 64-year-old population have received at least one dose, So the next few days, we're going to reach a really cool milestone, and that will be our 1 millionth dose delivered or administered. And it's going to be hard for us to nail down specifically when that's going to occur, but it will be coming in the next few days, and we're really excited about that milestone. Last week, we announced our administration's efforts to ensure that all Utahns have a fair opportunity to get vaccinated. We really want our vaccines to reflect our population. We want to make sure that we are not leaving anyone behind in vulnerable communities or vulnerable populations or hard to reach locations. And so we've been working really hard on that vaccine distribution roadmap to make sure that we're encompassing everyone. And that plan continues to be refined. This week, we had stakeholders from our homeless, our disabled, and our rural communities that were involved in fine-tuning that roadmap as well. On Monday, I had the opportunity to visit the Utah Refugee Center to their vaccine clinic, and it was just really incredible to see people in action there and the hope that that is giving to our refugee community. There are a lot of barriers that we have to overcome. Those barriers can include They can include language. They can include location. They can include religious preferences or other distrust of the vaccine or of government. There are a lot of barriers that we're working really hard to make sure that we overcome. And especially there at the Utah Refugee Center, their folks are working really hard to make sure that people have good information, that they have good access to vaccines. And it was really incredible to see. And I personally want to thank them and everyone else who's working on this for their incredible efforts. This idea of protecting ourselves with a vaccine is also really important to understand that when we do that, we're protecting everyone. And so that is something that a message that we really need to get out, that when you protect yourself by getting a vaccine, it's not just for you, it's also protecting the community at large. And we hope that people will continue to get vaccinated as doses are available. And the governor will talk more about that. We're working really hard to get every single dose that we can from our federal partners. And as soon as we get doses, we will get those administered to people. And we're doing a good job. And this local health departments and our other partners who are working on this vaccine distribution are really engaging in a monumental effort, and they're doing a great job. So thank you to all of them. And with that, I will turn the time over to the governor.
Thank you, Lieutenant Governor Henderson. Ladies and gentlemen, it's great to be back with you again this week. The legislative session is over, and everybody's breathing a little bit easier. I just want to start maybe today with a reflection, if I could, on the past year. While the pandemic did not start a year ago for many of us, today marks the day when I think it became real, and we knew and realized that things were not going to be the same. Today was the day of that fateful Jazz game when Rudy Gobert and Donovan Mitchell tested positive, and the next day the NBA shut down, and so many other institutions and facets of our lives begin to change. I want to first and foremost thank our frontline workers who over the past year have dedicated their lives to saving lives. They deserve all of our respect and admiration. We're so grateful for what you've done. We unfortunately did come extremely close to overwhelming our healthcare system at one point, and grateful that case numbers have come down and that our hospitals are not overwhelmed right now. But you have been and continue to be the heroes through this pandemic. I also want to recognize the lives of so many families who have been impacted in our state. We're now closing in on 2,000 people who have tragically lost their lives to this pandemic. And even though that was the best case scenario at the beginning of this pandemic, it's still incredibly tragic for those of us who have friends, loved ones who have lost their lives. Our hearts go out to you. To those who are struggling financially or economically, businesses that have struggled, we also give you our respect and admiration. We've had many opportunities to help those in need, and we're grateful for Utahns who have stepped up, and we know that more relief is coming. But I do think it's an important time to look back at where we are, because it gives us perspective about where we're going, and it gives us hope for what's happening right now. I had a call this morning with Jeff Zients, who's leading the vaccination efforts for the federal government, for the Biden administration. We talked specifically about Utah, the numbers. He was blown away at the numbers that you just heard from the lieutenant governor, with our people 70 and older vaccination at a rate of 79%. That's well ahead of the national average, and is really setting the standard for protecting our most vulnerable. And as the lieutenant governor also mentioned, we're now branching out to find more of those people who have who are homebound, who can't get out to vaccination clinics, to make sure that we push that number above 80. We also have a significant now number, 64% of those ages 65 to 69 that have been vaccinated, and a growing portion of those over the age of 50 and with underlying health conditions. So we feel incredibly optimistic about where we are. Now, there's been some discussion about the numbers and why is Utah last when it comes to a percentage of total population vaccinated. We've touched on one of those issues, but I also brought up with the Biden administration a second issue. The first issue is that we should not be reporting, and he agreed with this, we should not be reporting a percentage of total population vaccinated because kids under the age of 18 or under the age of 16 in the case of the Pfizer vaccine are ineligible to be vaccinated. And because we're really good at having kids here. We have more kids per capita than anywhere else in the nation. We don't get doses allocated for our kids. So removing those, but even once you remove those, we're still below the national average in vaccines allocated to our state. And that was a question we had because the formula is fair. The formula is based on adult population. And so we should all be pretty close to the same. But there are several states, and Utah is one of those, and some of our surrounding states that are at the low end of that. The reason we believe, and this was a conversation we had, is that the data they're using to distribute those vaccines is a couple years old. As such, states that are fast-growing states will be disproportionately disadvantaged when it comes to the amount of vaccines that are coming to us. And we are the fastest growing state in the country over the last 10 years. That's not just young people and our birth rate, although that's certain part of it, but we are also in the top 7 or 8 for in-migration, as are some of our neighboring states, Nevada and Arizona. And so we are at a disadvantage. We're being told that they will have a refresh on that data and they'll be able to use newer data starting in the coming weeks, which should help us get more doses to the state of Utah. But the good news is that our partners, as the Lieutenant Governor mentioned, are doing an incredible job of getting those doses into arms as quickly as they are coming in. And so we'll talk more about that in just a second. There's also been a lot of talk around the legislative session and around House Bill 294, which passed both houses with a veto-proof majority. I want to address that just briefly. I obviously don't love the bill. We had already put forward our recommendations. We believed that it made sense to get enough vaccines to administer to all adults that wanted those vaccines before portions of the mask mandate went away. The legislature disagreed with that, which they are entitled to do, and they were able to pass a bill with a significant veto-proof majority. And in our negotiations, we came up with the best we could do. We told them, look, every day, we get 25,000 at least new people get vaccinated and get closer to that immunity and that herd immunity that we're working towards. So we'll take as many days as you can give us. We ended up with April 10th, and I want to point out a couple things with that. So the entire mask mandate does not go away on April 10th. We still have a mask mandate in schools. We still have a mask mandate in large gatherings over with 50 or more people. So that's the first important thing. The second part of this is that businesses can and should still require masks in their places of business to protect their workers and their customers. There's nothing at all that prevents businesses from doing that. And we know that businesses have done that in states without a mandate. They did it here before we had a mandate, and they can certainly continue to do that until we get people vaccinated. And so that absolutely is something that can and should consider. We also have to take some personal responsibility. If you are not comfortable, if you are at risk, if you have not been vaccinated, then take precautions, still socially distance, physically distant, still wear masks, wear better masks, wear double masks, things that we know that science and experts have told us can protect us from this virus. Those are things that we can do now. We also have to be able to assess risk. We do this every day. We're at great risk here in our state for having an earthquake, right? But we take those risks into account and we make the changes to our lives that we feel are necessary based on that risk. The same thing is true of the virus. If you've already been fully vaccinated, then obviously you don't have the same risks that you would have if you are at risk and not fully vaccinated. If you are a high risk individual, then you may have to take precautions that are different for low-risk individuals. These are things we can all do, and there's nothing wrong with us taking those into consideration in the decisions that we are making. Now, I want to talk a little bit more about vaccines, then I want to talk about what's happening with the transmission index. You can find vaccine appointments. For those that are looking, there are lots and lots of different places. I wish that we could have this all in one sign-up form, but that's impossible. And the federal government continues to give doses to pharmacy partners that we don't have insight into and that we have no control over. So there are lots of different places for those that are eligible, everyone over the age of 50 and with the underlying comorbidities to get vaccines. Now, you can go to coronavirus.utah.gov and use the link at the top of the page that says, "Where can I get vaccinated?" This vaccine distribution page features trusted partners at health departments, healthcare providers, and local pharmacies who are administering doses every day. One of the important links on that page is Vaccinefinder.org. This is a CDC resource and is a great central clearinghouse for all vaccines available in Utah. You can search by the type of vaccine and by your location to find available vaccines near you. But remember, you also don't have to get a vaccine near you. You can go anywhere in the state if you are able to get there. Anywhere that there is an opening, you can sign up. Again, if you meet the eligibility requirements, Vaccinefinder includes local pharmacies as well as health departments. Most of our large providers are filling all appointments. Some of our large counties are scheduled out through the end of this month. But again, let me stress the importance of being patient when you go to make an appointment, and please, please, please don't give up. The other thing I will say is please, please, please do not make multiple appointments. Make one appointment and keep that appointment. When you make multiple appointments and don't keep one, that's an appointment that doesn't get filled by somebody else that desperately needs it. So if you have to wait a few days to get to your appointment, even though another appointment comes available, please just wait a couple days and take the appointment that you have been given. Now, I want to talk again about our transmission index. We now have 7 counties that are in high and 18 in moderate, with 4 in low transmission. New counties in moderate this week include Utah County, Tooele County, Iron County, and Sevier County. This is important for one really big reason. Since we started the transmission index, Utah County has been in high, and so it's a really big deal for Utah County to now be moving into moderate. I want to also re-emphasize what this means and what it doesn't mean. First, it does not mean that the pandemic is over. It means that disease is not spreading as much as it was before, so there can be fewer restrictions. But if we're not careful, and we're seeing a plateau this week, the virus can spread quickly again. We certainly don't want another surge, so still take necessary precautions. As a reminder, in moderate transmission areas, we can have fully open restaurants and bars. This means that you will see tables that are closer together than you have in those areas that are in high transmission areas. People still need to wear masks unless they are actively eating or drinking, and parties will still need to keep their distance in waiting areas. Events such as movie theaters, sporting events, weddings, recreation, and entertainment no longer have to require 6 feet of distance between attendees of different households. However, masks remain a requirement in these settings where physically distancing is not possible. Concessions can be open, but when someone removes their mask to eat or drink, they have to be able to maintain 6 feet of physical distancing from other parties. This means that if you are seated shoulder to shoulder in one of these venues with separate party in a movie theater or an arena, you will have to eat or drink your concessions in a common area or where you can maintain physical distancing. Again, this is all in moderate transmission areas. We still recommend that people practice physical distancing and wearing a mask unless you are by yourself or only with members of your same household, and that you limit social gatherings to 25 or fewer. Those are recommendations, of course. This is what we have expected to happen, an orderly lessening of restriction as the transmission follows. Well, there's one more thing that I need to say before we turn the time over to Dr. Dunn. Look, I know it's been a really difficult year, and I know that these issues around the pandemic can and have been divisive. But please act with respect to your fellow human beings. If you go into a business and they are requiring you to wear masks, wear masks. Don't yell at the clerk. Don't yell at the store manager. Don't make a fool of yourself because you don't want to wear masks. The government, after April 10th in those settings, will not require it, but businesses absolutely have a right to require masks. And if you don't like it, go shop somewhere else, okay? We don't need people to, Abby told me I can't use my farm words in here, but you don't need to be a jerk to people that you come in contact with. Conversely, if you go into a restaurant and a table is closer to yours than maybe what you think, don't yell at the waitress and tell her that you want people 6 feet away from you. If you don't feel comfortable going out and eating at a restaurant because you're at risk, then get takeout, okay? We have to treat each other with respect. All right. This is not a free for all. We live in a society. We should care about each other. And if you don't care about other people, then don't go to places where other people are. This is really important as we move forward. We're close to the end of this pandemic, right? We need a measure of grace and patience with each other. There are some people that will want to wear masks for much longer. Don't mock them. Don't make fun of them. Right? They're likely protecting their lives and protecting the lives of others. There will be other people who have never worn masks. Right? I understand how difficult this is, and that's okay too. We don't need to pile on those people. We've all made mistakes through this. We've all been critical of others when it turns out our side was wrong. Right? We can do so much better together. So we're so close to the end. We're getting vaccines out as much as possible. Please be kind to each other. Please be patient to each other, and let's show people what an incredible place Utah is to live. On that note, I want to thank Dr. Dunn for the year that we have spent learning together, for the guidance that she has provided this state through some of our darkest times. As I was going back through old text messages and pictures that we have of those first weeks of the virus, she was there at every turn, helping us get through this, working to get players home, working to get people off cruise ships back here, understanding what we had to do, contact tracing, figuring out how people had to respond, what it meant, how long we had to spend when we had contracted the virus, all of these different things. She's been here, as have our incredible health department, her colleagues, and the medical team. We're fortunate to have her, and I'll turn the microphone over to Dr. Dunn.
Thank you, Governor Cox. And yes, it has been a very long and roller coaster of a year. But we have great news today. We continue to see a decrease in our case counts. We are now at 524 new cases per day. That is a decrease from 558 from last week. This represents a bit of a plateau, but the good news is our percent positivity continues to decrease. We are now at 8.4% for person over person. That's a drop from 10% of last week. And we're at 4% from test over test. That's a decrease from 4.6% last week. And our referral ICUs are at 70.9% utilization. And there's only 66 COVID positive patients in our ICUs statewide. This number continues to drop. We've made some updates to our data dashboard that you'll be able to find on the website today. The biggest difference is that on the Trends tab, we now have information about the variant cases we have identified in Utah. You'll be able to see the number of cases and which variant they've been diagnosed with and where they live. We're going to show 33 cases infected with the B117 variant. This is the variant that was first identified in the UK. However, we do expect this number to increase within the next day or so. Our partners at ARUP diagnosed about 30 additional B117 or UK variant cases yesterday, and those will be added to the dashboard in the coming day or so. So these numbers, the 70-ish individuals who have been diagnosed with a variant, shows that the UK variant is spreading here in Utah. We know that it's more contagious than the other variants and that it does cause more severe disease in our younger populations. However, we have really good news. The vaccines work against the variants, and we're doing a great job in Utah at getting the vaccine out to our population. So it's so important that when the vaccine is available to you, you get it. Also, we know how to protect ourselves against the variants, right? Masks work, physical distancing works, staying home when you're ill, that all works. So let's keep using those tools until we all get vaccinated. We also have one of the best public health labs and surveillance teams in the country. This allows us to be able to monitor the number of variant cases in our state and understand the spread, and then get that information to you in real time. This allows you to make the best, most informed decisions to protect you and your loved ones against COVID. So we're on our way to the end. We are so close. And we're really fortunate to be able to have a decrease in cases, hospitalizations, and deaths at the same time we're increasing our access to vaccines. Thank you.
Thank you, Dr. Dunn. And with that, we can take some questions.
Hi, this is Emily Means from KUER. I have two questions. Local business owners are asking for their frontline workers to be vaccinated immediately in anticipation of the mask mandate ending. So I'm wondering what the timeline is for opening eligibility to those workers specifically.
There will be no timeline for opening eligibility to those workers specifically. Those businesses can require masks and nothing would change for them. We've said from the very beginning that we are taking a risk-based approach. That being said, we are anticipating, as I said last week, that by April 1st, we will open eligibility up to everyone in the state of Utah, every adult in the state of Utah, to be able to get the vaccine. Now, again, we know we won't have enough vaccines at that point for everyone in the state of Utah. And so people can will be able to starting on April 1st, be able to get in line and start taking those appointments. Again, that is all based on our ability to continue to get vaccine from the federal government. That there are no hiccups in the production schedules. That the weather doesn't cause any more delays. So we put all those caveats around that. But we're certainly looking towards the very real possibility that on April 1st we will be opening that up much more broadly. And so the good news right now is for those workers, if they're over the age of 50 or have any underlying comorbidities, they can go and get a vaccine right now.
Thanks. And my second question is for Dr. Dunn. In January, the Department of Corrections announced they would begin vaccinating inmates who are 70 years and older. Can you give us an update on vaccinating incarcerated people now that eligibility has expanded? And if you could talk about that in the context of state facilities and in county jails.
Sure. So we work really closely with our local health departments where those facilities are located to make sure they have access to the vaccines for the incarcerated population and staff. So some have been going out there with their mobile vaccination teams to make sure they have access to it. And we're working on broadening that access throughout the state as vaccine eligibility increases, also having the capacity to do more mobile vaccinations. And of course, Johnson & Johnson really improves access to this because it's a single dose and doesn't require the extensive freezing as others. So that is part of our plan and it's already going on.
Morning, Governor. This is Sean Means of the Salt Lake Tribune. You talked about everybody being eligible by April 1st is the goal. Do you have any more sort of granularity about intermediate steps between now and April 1st? As far as people 40, people 30 or older, whatever.
Yeah.
Anyway, go ahead.
No, thanks, Sean. We don't anticipate that there will be any changes between now and that announcement. With this last announcement, by moving it to 50 and then including a really large group of comorbidities. So those with a 30 BMI or higher. That's a large group. That was about 700,000 adults. So that's a really big swing, and that should should get us to that April 1st timeline, and then we would open it up more broadly and just go to anybody that wants one at that point. So that's what we're looking. And again, that was scientifically based, as we mentioned last week, because every one of those now eligible, those are people that have a risk factor above 1, and the rest of us, myself included, don't have that higher risk factor. And so at that point, we feel more comfortable opening it up more broadly to anyone that wants one.
Okay, thank you.
Good morning, Governor Cox. Rick Aaron, ABC4 News. You mentioned the allocation problems from the federal government. Can you give us an idea of what the actual shipments are like now compared to the projections? And how frustrating has this problem been to you?
Well, it's very frustrating, Rick. Let me tell you this: we are prepared right now, and I'm so proud of our team, the local health departments and our state health department, because this has never been done on this scale before, and we know that there are more doses coming, significantly more doses, and so we've been trying to stay one step ahead of the federal government. I feel like we're 2 or 3 steps ahead right now. We have the capacity right now in our plans to deliver 300,000 doses per week, and as you heard, we're at about, was 150,000 doses per week right now. So if they could double it tomorrow, we would be there. The Johnson & Johnson rollout's going a little slower than I know we had hoped for and that they had hoped for. And so that's certainly a challenge, but we are told that by the end of the month, and again, moving into April, we should start to see much bigger increases in the doses that are coming our way. So that's what we're preparing for, and we are prepared for it, and we're excited to move from this scarcity mentality that we've been in, and then really focusing on helping reach those again, the hardest to reach populations that were talked about before. So we've just got to get more doses. They know that, and they're committed to getting more to us, and we're waiting with open arms. Last question.
Good morning, Governor. It's Rudy Nieves with Telemundo, Utah. I have a question for Lieutenant Governor Henderson. I don't know if she's still there.
She is, yeah, Lieutenant Governor.
Awesome. So my question is how the Hispanic community is responding to the vaccine equity roadmap, if you can give us any insights about that.
Yes, thank you for the question. We're working really hard. Our local health departments are partnering with those in the community who have special insight and access. I know that we've got Summit County who is making really good headway there. We've got people in Utah County specifically targeting and reaching out to members of the Hispanic community, for example, as well as other communities that might be a little bit more difficult to reach or have special barriers that we need to address. So we are doing that. We are doing that through our local health clinics. We are doing that through when we get enough doses, we'll be sending out the mobile vaccine vans. But we are working very closely with our community partners to make sure that those that everyone who wants a shot can actually get one.
Okay, and I think we'll do one more quick one. Am I okay to do one more? Yeah, we'll do one more quick.
Okay. All right. Thank you, Governor. Yes, this is Paul Nelson with KSL News Radio. You mentioned the data that the federal government was using in order to figure out how to allocate doses was outdated, and that there's going to be some changes to the data that they receive. What kind of data problems were there? What kind of data needs to be fixed? Is it just a population number, or what exactly was wrong with the federal government's data?
Yeah. Thank you, Paul. So there's nothing technically wrong with the data. It's good data. It's just older data. So the database that they're using is a couple years old, and of course we've had significant population shifts over the last couple years. We don't know exactly what that will mean when you start using newer population numbers. We don't know how significant that will be, but it will mean more doses per capita for Utah than we're getting right now. So that's our hope. We were told today that in the coming weeks, we weren't given a time frame, but we were told that they would get us more information, that they would switch that data, and that's good news for Utah. So with that, I think Dr. Dunn will be around for a couple more questions if you have any for her. Again, I just want to thank our media partners for your help over the past year in getting good and accurate information out to the citizens of Utah. We can't do that alone. You've been so helpful and literally saved lives by getting good and speedy and accurate information out to people. We appreciate you doing that now, and we look forward to seeing you again next week. Thanks, everyone.
Thank you. Dr. Dunn, Daniel Woodruff here with KUTV. Just checking the dashboard, and I noticed that the death count has crossed that 2,000 threshold. It's 2015. Your thoughts on that, particularly as you reflect on the last year, where we've come since a year ago today?
I mean, each one of those deaths is, of course, tragic, and it's public health's job to try to prevent as many as possible. And so I think we've done a good job, but there's always room for improvement. And moving forward, it's a great sign that cases, hospitalizations, and deaths subsequently are decreasing. And we'll keep working to make sure that that goes to zero.
Thank you.
Hi, Dr. Dunn. This is Spencer from Fox 13. I have two questions for you. First off, obviously this is a hindsight day where we're looking back a year ago. Is there anything specifically that you can point out that you think we could have done better to learn, or hopefully this doesn't happen again, but if there is a next time that we can actually look to that to make sure that that wouldn't happen again and we can do something differently that would have helped?
Yeah, absolutely. I mean, after every outbreak, there's always something we can learn, and especially in a pandemic. So we will be systematically going back and making sure that we identify all of the lessons learned. I mean, off the top of my head, I know that from the beginning, we will in the future engage more multi-sector partners and make sure that we have, education, economics, elected officials, and health experts at the table from the very beginning. I think that could have, sped up our process in terms of understanding the broader implications of a pandemic. But hindsight's 2020. I mean, we had no idea it would be this big of a pandemic lasting this long with this big of an impact on all aspects of our lives. But I'm sure there'll be more lessons learned to come.
And then quickly, my second question is, some states are targeting asthmatics as a part of their initial stages within that 30 BMI range. Is there a reason that Utah is not targeting those asthmatics as a part of those pre-existing communities?
Sure. As Governor Cox mentioned, we really looked at the specific data for risk for hospitalization and death. And individuals with asthma are at lower risk than those with diabetes or obesity. And so in order to make sure that individuals at the highest risk for hospitalization and mortality due to COVID had access to the vaccines first, we prioritize those with diabetes and obesity.
Thank you, Dr. Dunn. I appreciate it.
Good morning, Dr. Dunn. Jed Bowl here from KSL TV. A year ago, we only had three confirmed cases here in our state. Obviously, hindsight is 2020, but over the course of the year, some could argue that it didn't have to be this bad, that we didn't have to have as many cases. If you were to cite one thing that we might have done that could have reduced the spread of the virus, what would it be? And then also on the positive side, cite one of the things that did occur that helped us get past the worst part of the pandemic.
Sure. I mean, I think, a lot of the lessons learned will come out because we didn't know how COVID spread. And we didn't know how to protect ourselves because it was a novel virus. We had never seen it before in the world and transmitting between people. And so as the science evolved, we evolved our recommendations. And I think we can all agree that the biggest benefit, maybe that we won't all agree, but the biggest thing that really we discovered was the benefit of masks. At the beginning, of course, we had a shortage of personal protective equipment for our healthcare providers. So we didn't have the luxury of having surgical masks for everybody in our state. But as science evolved and we understood that cloth masks also helped prevent spread of disease, we started recommending those, and we did see a great impact on our cases, and we saw a decrease in cases because of that. I think a big benefit moving forward, hopefully, is that this has really highlighted the benefit of working collaboratively together across sectors in order to address a really big problem. And I hope that will continue moving forward across all health issues, so that we can better ensure that all Utahns, have access to high quality healthcare and can live the best lives possible.
Thank you very much.
Thank you. Dr. Dunn, Chris Reed, St. George News. Quick question on the vaccination front a little bit here. And those who have high-risk children, for example, those with children who have diabetes or cystic fibrosis, if they get both shots and are pretty much 95% immune, is it safe for them to have their children with them and other people from outside the household who've been vaccinated twice? What would be your guidance towards that situation?
I mean, this is something that definitely those parents and caregivers should talk with their provider about their specific situation. We do know that the vaccines are very effective at preventing severe disease from COVID. We're still unsure on how much it prevents transmission. It's likely very good at preventing transmission as well, but to those specific high-risk individuals who don't have the vaccine, it can certainly be a greater risk. So that's something that I would definitely recommend they talk to their individual provider about.
Quick follow-up, and I hate to bring up legislation with you because that's not obviously not necessarily your wheelbarrow here, but we have the April 10th date from HB 294. Is there a feeling at all, certainly judging by the governor's comments, that we're not necessarily under a public health deadline to get this done as much as a legislative deadline?
I mean, the fact that it was passed in the legislative session, I think by definition, it's a legislative deadline. We certainly in public health will continue recommending that individuals take all precautions necessary to prevent the spread of COVID-19 until we reach that herd immunity. And we're getting there. And so we'll continue to recommend best public health practices.
Thank you.
Hi, Dr. Dunn. This is Katie with Deseret News. You'd mentioned some of those variant cases you guys have detected. And I wondered how concerned are you guys at all about that variance as you race to vaccinate more and more people? At what point does it get concerning with the variants, or do you feel like vaccinations are coming out fast enough that it won't be a concern?
Sure. I mean, I think time will tell. It's definitely unpredictable, but we are certainly in a great spot with the speed at which we're vaccinating, especially at-risk individuals. I think we as individuals need to do everything we can to prevent the spread of COVID, and that will help prevent the spread of variants. And that'll allow us to get to that moment where, we can go to large gatherings and concerts and not wear masks. We're almost there, but we still need to kind of take it that last mile and make sure that we're able to get there without additional preventable deaths. Go ahead. Okay, last one.
Good morning, Dr. Dunn. This is Jacob from KSL.com. I think most everybody at this point, as we're vaccinating more people, people are mostly expecting to see cases continuing to go down. But it's been mentioned several times today that we're kind of seeing a plateau again. I guess what can you say to manage people's expectations at this point? Even though we're vaccinating more people, is there a possibility that we might see cases start to climb again?
Yeah, absolutely. I mean, we still have, about 85% of our population, 90% of our population susceptible to COVID-19. So we're certainly not near herd immunity where we can rely on the vaccine as our only protection measure. So it's still essential that we follow the basic public health principles of wearing masks and avoiding large gatherings. That will ensure that our cases continue to drop. I will say that, an average of 550 or so cases per day is fantastic based on where we were at the surge, but definitely not sustainable from a public health response standpoint. So we really need to continue to drop those cases to protect as many lives as we can. Okay, thank you guys so much.
All right. Thank you, Dr. Dunn. And to our other speakers, that concludes our press conference for today, Thursday, March 11th. We will talk to you again next week. I believe it's the governor's PBS Utah briefing will be happening next week. So we'll be joining you in a slightly different format. Thank you very much and have a wonderful Thursday.